Of course, I'm over here with superstar periodontist Dr. Mark King in Georgetown. For the last few interviews, we've talked about the services and the treatments that you may need. Well, guess what, everyone? Today is the day that we're actually showing a surgery of an implant and a tooth extraction. Welcome back to the show, my
Thanks
friend.
for having me.
Okay, well, we're doing it on moi. I'm the one having the treatment. Let's talk about the consultation process to begin with, so the patient understands what happens when they walk into your office.
Right. So typically the dentist paints the picture for how the appointment's going to go. They kind of know what they're coming here for, and we discuss that a little bit more at length than what they had discussed maybe in their office before they got here.
Okay. Imaging, or what people understand as x-rays,
Right.
that process.
Typically, say if you were coming for an implant, we would take a CAT scan. And on a CAT scan, you get a three-dimensional view of the area where the implant would go. So we get more information than a standard x-ray, which is just 2 dimensions.
Okay,
the length
I understand.
and height.
All right, so one of the things that is really important when you come to see a specialist is your recommendation from your dentist. They discuss the beginning of a treatment plan. Then you would come over and see Dr. King, and he takes you to that next step, the next level, may we say, of dental care and the service that's going to about to happen. What is happening with me?
Today with you? What do you know that's happening with you today?
Well, I've already done the consultation and the imaging. We also discuss the practice of the implant and the process, how long I need to come back and see you in between. Am I correct with what?
Yeah, you've had the
perfect.
hard part done.
Oh, really?
You've had a tooth taken out already.
Okay.
So that's typically the worst. The implant placement should be much smoother and less painful than what you've had done in the past.
What's the implant part? Is it metal nowadays? Is it
There's
screwed
a couple
in?
different options. So if we're talking options on implants, the traditional implants are titanium. With today's society, we're geared more towards more holistic type treatment, and they're actually implants that are all zirconia or ceramic now.
Really?
Yes.
So lifelong,
Either one should be
do we
lifelong.
need to get them replaced?
No, either one
Okay.
should be lifelong.
Interesting, everyone, interesting. Okay, now the actual surgery, you did say to me I had an option to be, what most people would like to hear, put under. So I wouldn't talk. Is that the plan?
Well, you need to be on the show, so
Okay. So I'm not being,
you're not going to be sedated today.
if I'm not being sedated, what's the process?
So if you're not going to be sedated, you'll still be numb. You're going to be numb whether you're awake or asleep, just
Okay.
because your body has a reaction to pain even if you're unconscious.
I didn't know that.
Yes, your
That's
heart rate
interesting.
increases.
Really?
Yes.
Okay, so when we say numbing, is it what people think as a block injection from
Exactly.
a dentist? So same feeling.
Yes.
Okay, so they would wait here maybe 45 minutes after the treatment if you're only having numbing, and then can drive home if you are being sedated, different
Right.
scenario.
You know, typically if someone is not being sedated, they'll be able to drive afterwards. They'll just be numb, but
Okay.
they won't be mentally impaired.
Okay,
So if someone is being sedated, though, they do require a driver and someone to take care of them after the procedure.
I understand. Now, I've had the surgery, now what?
So
Home
now
care,
what?
when do I see you again?
We'll follow up with you pretty closely because we want to keep an eye on our patients as they're healing. But your aftercare should be relatively easy and simple.
All right. Well, I think we might need to do another interview
Okay.
after this whole process is finished and see how we
That's
go.
right.
See if you sedated me enough. Okay. If you want to find out more information about Dr. Mark King and his amazing services, he has such an incredible team. All his website and information is up on your screen now. We'll be right back after this short break.